So welcome back. This is the second recording focusing on psychological disorders. Now we're going to look at somatic symptom disorder. So this is a disorder in which the main feature is an excessive preoccupation with physical symptoms. And these physical symptoms, there may or may not be a medical cause to explain them. So the person may or may not be diagnosed with a medical condition, but it's not the physical condition that is the disordered pattern here. Rather, it is the person's reaction to the physical symptoms. So the person becomes excessively preoccupied in their thoughts. They're thinking about it excessively, in their feelings. They're worried about it excessively, and in their behaviors. They consult physicians until to the point that they seek to find someone who's going to diagnose them with a condition. Okay, so the person's reaction is what is problematic because it causes clinical distress. So the person is distraught over the preoccupation that they have with their symptoms. They are distraught. They are significantly preoccupied with them. They're experiencing distress, psychological distress, or they're experiencing functional impairment. So they can't function. This is occupying the majority of their time and energy, and they can't carry out normal functions in important domains in their life, such as social domain, vocational domain, or any other important roles that they have in their life, like being a parent or a caregiver. So now we're going to look at anxiety and anxiety-related disorders. So important to note that anxiety is a normal, healthy emotional state. We do need to experience some level of anxiety because it allows us to steer away from perilous places. It allows us to steer away from environments where we might experience harm or danger. And so this future-oriented state where we anticipate, we are apprehensive about something that has yet to occur, does allow us to respond adaptively by keeping away from perilous places and perilous situations. Okay, so for instance, we know that it's not very safe to venture into dark alleys at night. Okay, that's because of that anxiety state we feel when we face that situation, a dark alley at night. Okay, so, but the emotional state does become problematic if it's uncontrollable, if it is persistent. Okay, if it is persistent, the person has no control over it. If it is disproportionate to the actual danger that the person might be experiencing, if it is causing significant distress, like the person is distraught over the situation, over the condition that they're experiencing, or if it causes functional impairment. So it's disrupting their life. So experiencing significant distress does cause disruption in ordinary life. Another way it can be expressed is by the person showing functional impairment in important domains of their life. Okay, so that's anxiety disorders in general as anxiety disorders as a classification involves fears that are uncontrollable, disproportionate to the actual danger that the person might be in, and disruptive of ordinary life. And the Diagnostic and Statistical Manual of Mental Disorder recognizes 12 types of anxiety disorders. The most common form of anxiety disorder is generalized anxiety disorder. Okay, so this is where the person's anxiety generalizes across all areas of their life. Okay, so it's not tied or predominantly specific to one domain or one feature of their life. Okay, like social anxiety disorders when the person is afraid of situations where they might be judged or negatively evaluated by others. But so it's very specific to that situation, to those social environments. But in generalized anxiety disorder, the anxiety generalizes across all domains of the person's life. So in generalized anxiety disorders, that's different from everyday feelings of anxiety. Again, it is normal to have some anxiety. So generalized anxiety is persistent anxiety. It is excessive, it is uncontrollable, and it's disproportionate to the level of threat or danger that the person may face in their daily life. So what are the criteria for a diagnosis? The person must experience persistent anxiety for at least 6 months. So persistent means that the person experiences anxiety more days than not. Okay, so if within the last 6 months, the person can say, yes, I've been experiencing anxiety on more days than not, it's persistent. It persists in their daily life. Okay, so, and it has to occur for at least 6 months. So it being the dominant state more days than not has to occur for at least 6 months. And the person is unable to specify the reasons for the anxiety. So there is no cause for it. Like if somebody loses a job, okay, and they're facing economic uncertainty, okay, if someone undergoes a divorce or has a custody arrangements with a former spouse, then that could be creating some anxiety that is connected with that event. It shifts from one aspect of their life to another, but it never goes away. Okay, that's a very important point. It comes and goes, but it never stays away. So let's look at the Okay, so now we're going to look at the biological contributors to the development of generalized anxiety disorder. So there is a strong genetic contribution, and it specifically impacts levels of GABA in the brain, reducing this neurotransmitter or impairing its function. So there are decreased levels of gamma aminobutyric acid that lead to decreased inhibitory neurotransmission. So GABA being an inhibitory neurochemical, it acts to suppress neurotransmission, and in those with generalized anxiety disorder, lower levels of GABA lead to a reduction in inhibitory neurotransmission. And so that the lack of suppression that is seen in non-clinical patients contributes to increased anxiety symptoms in those with generalized anxiety disorder. So there's lower levels of GABA. Okay, so there's a GABA deficiency. There are also problems or respiratory system abnormalities, and there are also problems in regulating the sympathetic nervous system. So the sympathetic nervous system is part of the autonomic branch of the peripheral nervous system, and it's important for regulating the fight and flight response. Okay, and so the fight and flight response is adaptive when it is transient or temporary, but in those with GAD, there are problems in regulating the sympathetic nervous system, of which the fight-flight response is a part of, and this may also contribute to the respiratory system abnormalities that they experience. Now we're going to look at panic disorder. So these are recurrent, sudden onsets of intense terror that often occur without warning and with no specific cause. Okay, so these panic attacks occurring without warning produce marked physiological symptoms. So these are severe palpitations, extreme shortness of breath, chest pains, trembling, sweating, dizziness, feeling of helplessness. So the person experiences a lack of control of what they're experiencing. They're experiencing helplessness, and it's described as though the person is having a panic attack. And so let's look at so that's panic disorder. So now we're going to look at specific phobias. So specific phobia occurs in an individual with an irrational, overwhelming, and persistent fear of a particular object or situation. Okay, so the person may have an agoraphobia, so the fear of going outside and being in a large space, like outdoors, where it's difficult to escape. Okay, the person may have allurophobia, which is a fear of cats. Okay, so now we're going to look at specific phobia. So this is a specific phobia is when it occurs in an individual who has an irrational, overwhelming, and persistent fear of a particular object or situation. So a normal fear becomes a phobia when the person goes to extreme lengths to avoid the object or situation. So for example, if a person has a phobia of cats, or what's called allurophobia, they may start to avoid leaving their house in order to avoid encountering a cat. Okay, so the specific phobias can be seen as an extreme and unfortunate variant of the adaptive role that fear plays in our survival. So some amount of fear is normal, healthy, because it allows us to escape or fight in the presence of danger or a threatening stimulus or a threatening event. Okay, so it keeps us to avoid any harm or injury or death. But having too much fear can become debilitating. So what are the causes? So many explanations of specific phobias view them as having been based on experiences, on the memories that come from those experiences, and on the classical conditioning or the learned association between the aversive experience and the objects or situations that were present. So if a person has had a traumatic or a very averse experience on a plane, they may develop a fear of flying. Okay, so it doesn't mean that if they fly again that they're going to encounter an adverse experience. It is irrational. It's not likely that they're going to encounter another adverse experience. There's no indication of that, but it may be based on the learned association that was formed during the original adverse experience. But it's also important to note that there may be an important role that genes play in the risk for developing a phobia, because phobias also exist in individuals who are not able to readily identify the experiences that cause the phobia. So they have had no adverse experience. Then the occurrence of phobia in those individuals tells us that there are factors that other than experiences that may also be contributors and rising the risk for developing a specific phobia. And those may be genetic factors. So let's look at another anxiety-related disorder, which is social anxiety disorder. So this is also called social phobia. So it's an intense fear of being humiliated or embarrassed in social situations. And genes seem to play an important role in the development of this form of anxiety, because individuals with social anxiety are more likely to have a first-degree relative with social anxiety than individuals who have no clinical disorder. Okay, so that's one biological factor is genetic disposition. Another is neural circuitry. So this involves the amygdala. So in plural, amygdala, because there are two. Cerebral cortex is also part of the circuit that contributes to the development, has been for which there's evidence that this area being part of a circuit. Okay, so now we're going to continue with the role of oxytocin in the development of social anxiety disorder. So it is a neuropeptide that plays a role in reproduction and social bonding. It's called a neuropeptide because it influences both the nervous system, but also has impact on the body. So it travels to the rest of the body through the vascular system, and it plays an important role in reproduction and social bonding as well. It's also known as the love hormone. Sometimes it's called the cuddly chemical, and it influences feelings of love, trust, and social connection. Okay, so it has been shown to play an important role in anxiety disorders in general, and in particular, it has played a role in social anxiety, so social anxiety disorder. So studies have shown that oxytocin may help to alleviate some of the anxiety symptoms that individuals with social anxiety experience. And this is done potentially by diminishing the amygdala's response to fear and stress. So there are studies suggesting that levels of oxytocin are lower, or oxytocin transmission in the nervous system is diminished, or there's a deficiency in oxytocin transmission in individuals with social anxiety disorder. And so for now, it's important to point out these three biological factors. So the genetic disposition, neural circuitry, and oxytocin, and psychological factors that can contribute to the development of social anxiety disorders is that an individual may have had a learning experience where they've come to associate the being in the presence with others as being an adverse experience, because they may have experienced rejection or embarrassment in a social context, such that they come to avoid social contexts in the future because they evoke an anxiety response, a stressful reaction in them. So now we're going to look at so we'll continue with obsessive compulsive disorder. So this is a disorder that falls under the classification of obsessive compulsive and related disorders. And so in this condition, the person experiences unwanted, persistent, and intrusive thoughts and impulses. And so these are described as the obsessions. And they also experience the urge to perform repetitive actions, ritualistic actions, which are described as the compulsions, that are intended to suppress the unwanted thoughts and impulses. Okay, so for instance, the person can be engaging in compulsive hand washing. So they may have a persistent, intrusive, and unwanted thought that they're going to experience some bacterial infection, and they have to rid themselves of this by engaging in compulsive hand washing. And so the person would count the number of times that they wash their hands or that they apply sanitizer on their hands. So compulsive hand washing is a symptom. Checking or counting, so checking that the stove is off, counting the number of times that they've checked. Okay, so these are the compulsions that a person performs in order to rid themselves, to eliminate the unwanted, persistent, and intrusive thoughts. Okay, so in obsessive compulsive disorder, the person feels overpowered by these intrusive and nonsensical thoughts. So these are the obsessions. So they have to check a number of times that the stove is off. That's the nonsensical, obtrusive thought. Okay, it's very intrusive and it's unwanted and something that the person can't control. And then they engage in repetitive actions. These are the compulsions in order to suppress the unwanted thoughts. Okay, so they engage in ritualistic manner in these repetitive actions. So it might be switching the lights on and off a number of times, checking the stove a number of times. So that those are repetitive ritualistic actions that they perform in order to suppress the unwanted thoughts. So the obsession may come in different ways. It could be a fear of germ or contaminants.
Welcome back. This is the second
an obsession about symmetry and exactness. So the person may arrange all the writing instruments in a symmetrical,
is a disorder in which
an exact way.
The main feature is an excessive preoccupation with physical symptoms.
And these
suppress these
unwanted obsessions.
There may or may not be a medical cause to
repetitive and
so the person may or may not be diagnosed with a medical condition,
cleaning.
But
so
it's not the medical,
cleaning
the physical condition that is the disordered pattern here.
Repeatedly.
Rather, it is
they
the
use
person's
masks or gloves to do daily
physical
things. Again, it's
symptoms.
So the person becomes excessively
preoccupied
the fear of germs or
in their
contaminants.
thoughts. They're thinking about it excessively.
And then
in their feelings, they're worried about it excessively.
For the person who has
and in their
or in their
obsessive
behaviors,
unwanted
they
thoughts
consult
about symmetry and
physicians
exactness until
they may put
to the
things
point
in a certain
that
order.
They seek to
and
find someone
the
who's going to
ritual.
diagnose
So
them
repeat
with the ritual
with a condition.
organizing
things
in a certain order.